So another question which was sent to me to ask you is there long COVID in India, and how do you deal with it? Because the person who asked me said she just had a patient with long COVID problems and she didn't know well what to do, and she asked, are there certain protocols to use for long COVID?
The long COVID means normally it has been clearly written by Hahnemann as sequelae. Sequelae means after some diseases you will get some problems and that will get attached to your normal disease or the constitution. So that is what Hahnemann meant as sequelae. So how to treat the sequelae is simple: take the totality, because that particular disease went inside you and that produced some symptoms which may be like you have got SLE. Now people are getting SLEs and MR, so many things people are getting. So what is the cause of that? Because this particular virus or whatever when goes inside the man, which causes some sort of problem in the vitality, and what vitality express outside, that is very important. We have to deal with what vitality is showing out. That is what Hahnemann taught us. That is what the totality of the symptom, and that is what the similia similibus curanter. And the one and the only protocol in the homeopathy is similia similibus curanter. Yeah. There is no other protocols. Yeah. So people are behind so many protocols, and you just think one thing: if you are away from the basics of homeopathy, if you are not giving importance to the basics, like the similia similibus curanter, the totality, and the repertorization, and all these basics, if you are not there, you won't get the patients. Because what happened in the Western world, if you can think about the Europe and you can think about America, even the homeopathy originated in the Europe, it flourished in Europe and it flourished more in America, and now it is not there. What happened? There is no patients there? No. Because the people who are behind so many other protocols, they just leave the original Hahnemann, and I believe because of that, it's failing. Because the people are not having faith in that. Because of that, people are not having confidence. Not the patients having confidence, the doctors who are doing. Because they just forget all the basic principles. When you look at India, after the COVID, even though before the COVID also we are having a lot of patients. Maybe you will say we have a lot of people there. No, not that is the reason. But after the COVID, we are getting a lot of patients. Why? Because when
more popular, you mean?
Yeah, because when COVID arrived, the whole world was like stumbled up. They panicked. Yeah. What to do? At that time, we got a principle. Why we are afraid of this? During the 2020 March April month, I got a lot of patients from Spain and from US. I deal very easily. At first I thought, oh my God, this is a new one. But when I get the symptoms, I got a patient. My first patient was from US. That guy was an illegal immigrant. So at that time, the problem was he was not able to go to the hospital. Even for a COVID test, he has to give $350. So what happened? He just went to my friend, and she called me, and we did online consultation, and it was like when we took the case, it was like he got pneumonia also. He was diagnosed as pneumonia. So we took the case. I got Roostox, and we give the Roostox, and within 1 or 2 days he's normal. He went back to the work. Likewise, we got patients from Spain also. At that time in Spain, the problem was like the elder people, they were not taken to the hospital because the hospital beds were reserved for the younger ones. It's very irony, you know. So at that time, we got patients from Spain also. At that time, the COVID was not that much into the India, because in India, it was like in June, July, the COVID came. So I got exposed to all these cases before the COVID came to India. So when it appeared in India and in my place, it was easier for me because I have tried my normal medicines. I didn't give anything new. Everything by Hahnemann. The Roostocks, the first one, the COVID first, I think the alpha, the first one, the virus.
Yeah.
So the alpha, we treated very easily with Bryonia, Roostocks, maybe the camphor, like that. But in the second phase, it's Delta. Delta was a bit difficult because the people was afraid. You know, the people are, the TV and the channels are showing the people are dying. Dying. People are dying. People are not having oxygen. And the people who are not having disease also, they are going and collecting the oxygen cylinders with them. So that much panic. At that time also, and that time the remedy changed a bit. A more deeper one. So I got more results with chininum sulph, chininum ars, like that. So it's gone a bit deeper inside. So even though we are getting the rubrics, we are getting the symptoms, that is very important. Not the new disease. We can't find a corona or a COVID in a repertory. No. But we can find the symptoms of the patient: restlessness, fear of death, the pain in the back during fever, vomiting during the fever. So Hahnemann clearly mentioned how to treat intermittent fever, because most of the cases of COVID were intermittent fevers. And it's very clearly mentioned in organon. So whatever the disease which is supposed to come after 200 or 300 years after also, we can treat with homeopathy, because that is the clear principle of homeopathy, similia simile muscuranda. And I believe in that, and we are getting so many results with that also. But after COVID, you know, the sequelae or whatever terms you are using, the person who are getting complication after COVID, a lot of patients are coming now. And we are treating them very nicely, only with the normal, conventional, maybe the Hahnemannian remedies. So I think maybe the 95% of the cases we can deal with the normal remedies.
And so on the news, it's being presented as if it's long COVID, the result of the COVID. But some other people suggest that it might be the result of the vaccinations. So that it might be you had the vaccination, and often they get COVID still. That it might be a accumulation of the spike protein. How to deal with it if you think it might be the vaccination, or you're not sure if it's really only the long COVID? Is there any difference?
Yeah, this is a controversial question, but I will answer. But the thing is, we don't know whether is that due to our vaccination. If the patient is getting the symptom directly after one day, of the next day or the next hour, the patient is getting symptoms. We have a lot of cases like that. The patient got a disease, just the next day she got a vaccine. So we can say that this is due to the vaccination. Otherwise we can't able to say that, because there is no proof that there is no proof. And obviously the medical society won't go for that also, because they don't believe in, they are nowadays they say that there are some complications in the vaccines, but it is not, they won't say that this is due to vaccination. But after COVID results is like, if some people, they are not having vaccination in India, so many people, they didn't do the vaccines. So I personally, I have seen the people who did not take vaccinations, they don't have any complications. 90-95% of cases, they don't have any complications, or they don't have anything. They got the COVID, it went off like that. But the people who took the vaccination, when they are getting the COVID, I saw in many people, they have got so many complications. Because, but I can't able to say that whether it is due to that or not, because it should be proved in the, the scientific decorum. I can't able to say it because of the vaccine. But whatever it is, even though if it is after vaccination, or even though if it is after the COVID, it doesn't matter for homeopaths. Because if I would say Rene is coming to me as a normal person, you have a disease, I am treating you, okay? And if you got a vaccine and you are coming to me as a Rene, but what else you got after the vaccination? That will be shown by you, right? And you have the totality of that. So you will give me that, and I will just take the totality. I will find the simillimum. Maybe the simillimum will be different. Maybe, I'm not sure. Maybe the simillimum will be different from what the previous Rene and the vaccinated Rene. Okay, you got the point. So we have to treat the patient. That's all. There is no protocol that you give this, you give that. No. If you have symptoms, clear symptoms, obviously sometime it's like 5%, maybe 5% of cases, they have a different sorts of symptoms. In that cases we have to work more, but that doesn't mean that you have to go for the protocols, you have to keep like this. No, the one and only protocol in homeopathy is similia similibus curanta.
So this word protocol, I see this popping up many times. There are new diseases or new problems, and people ask for, is there a protocol, how to approach, like the other Indian teacher, I forgot his name, the Banerjee, I think, with the protocols. What is your general approach about this, your position? I hear this all the time here in Europe, that people are searching for protocols.
Yeah, I will point out two things. Like Banerjee, you said about the Banerjee protocol. In his book, Banerjee's Protocol, he clearly mentioned that this is not homeopathic. Yeah, he clearly mentioned that this is not homeopathic. That is another thing. That is a protocol he made, and he is having some results. But I will tell you one thing. What is protocol, and why Hahnemann at his time, or at the conventional protocol, he removed all the protocols he found the similia similibus curanda. Why? Because the protocol is the word by the allopaths.
You mean the treatment methods at his time?
Yeah, because the protocols is meant for the allopaths.
Yeah.
If you go for a rectal cancer, or if you go for a cancer of the stomach, they have a protocol. Okay, they will treat the patient accordingly, that protocol.
Yeah.
But homeopathy purely depends upon the individualization. So when you go for individualization, there is no room for the protocol. Because protocol means you have a protocol and you have to give for every patient. So if you are getting 10 patients, you have to, if you are get 10 patients with the same fever, or maybe you say after the COVID sequelae, you have a protocol and the patient is coming with that. How could you able to give the same protocol for all the patients? No, there is no protocol in homeopathy. Homeopathy depends, the basic, the golden rules in homeopathy is the golden standards, I would say. It is the individualization. So every patient, every human being in the world is an individual. That is what Hahnemann coined. That is, we know that. That is the if you look at the modern books, modern allopathic books, modern medicine books. If you just go through that, there are a lot of pages regarding how you give importance for an individual. So they are coming to that line, and we are going to the protocol line. That is not acceptable. So I think because of all these protocols and all these things, all these confused things, homeopathy is degraded. It's degraded in Europe and Western countries.
Yeah.
But in India it is more evolving, because in India the people I think more than 60% of people believe in the basics of homeopathy. They are still going, the doctors, not the people.
You mean more than 60% of the homeopaths?
Yeah, the doctors.
They follow.
Yeah, because we have a good curriculum. We are studying homeopathy for 5.5 years. So we are studying the materia medica, the organon, the chronic disease, and every literature in the homeopathy. So the doctors who are coming out after studying all these things, they have a good knowledge of the basics. And most of the people are still believe in the basics. That's why they could able to do the things. That's why they are getting the results. See, personally, I'm looking more than 60 to 70 patients a day, which includes the acutes and chronics. And I'm getting results also, like more than 60 to 70%. I'm getting the results. So we are seeing that much patients a day, and we can't able to say them, okay, I will give one medicine and wait for this time, or otherwise I don't have to wait for 2 hours. It's like 2 hours I will look 15 to 20 patients.
You mean a long consultation, that you don't do long consultations?
I can't do that. How could I do that? Because maybe because of I have been practicing since 22 years. So it's easier for me to see, even though Hanuman say that you must not be prejudiced. But from the experience, somebody is coming, we will be prejudiced not for the, not for the medicine. But when they start talking, we know where to ask, what to ask. So we'll directly go there.
To differentiate?
Yeah, to differentiate. So during case taking, we will differentiate, and it's like 10 minutes, we can complete all the things. In chronic cases, maybe 20 minutes. If the case is more severe, I will give some other time, like half an hour maximum. We can't give more than that, because we have to look all the patients there, yeah?
But does it mean that your result is not optimal, maximum, that you just say, I just take a little time, I prescribe, and when it doesn't work, the patient will come back? Or are you accurate?
Yeah, most probably. I think maybe 60% I'm accurate. 60%. We are not supposed to be like Hanuman, because we can't able to cure all the patients. Maybe if it is not working, they will come back. So at that time, because every doctors or every human being, we will make errors, because the error is human. So there will be errors. Basically, in homeopathy, the patient who are coming to us, we have to differentiate it. Maybe he's a saint or a hypocrite, like the Vidulka said. We have to differentiate whether what is normal or abnormal. So for that, I'm using since a long time that I ask them to come with the the relatives, like the father or mother or spouse or something like that. So that's very easier for us.
You mean to check?
To check whether I believe in the verified symptoms. Verified symptoms. That is very important.
You mean confirmed by someone else?
Yeah. Someone else, like the spouse. They can confirm that. The patient says that, oh, I am very honest. At the same time, his wife or mother or father, no, doctor, he's lying. So we have a lot of examples like that. So when we take case, sometimes the patient or the bystander won't say. So I will tell them, you just go there and phone me. So the spouse may go to the house and they call me, doctor, the guy was totally wrong, and you got a different picture. So I will ask her or ask him. Okay. So it's difficult in chronic cases. But if you are, the practices make the things perfect, If you are dealing with 50 to 60 cases, in which most probably 30 cases are chronic for 20 years, that means you have practicing. So when you practice, you will be more and more, precise, and you know what to ask. That's different. So we are getting results also, because I have a lot of juniors in my clinic. They will come after the studies and they will sit there, so they know the things, and they are witnessing that also. So I believe the one and only protocol in the homeopathy is individualization, and that is coined by Hanuman, the one and only Hanuman, and it's still worthy. I think maybe more than 250 years, it's still going on, and it will still. You know why homeopathy is existing in the world? Only because it is working. It is worthy. But when you are not doing in the correct way, it will degrade. And I believe that is happening in the Europe. Why the more and more good teachers are not coming from Europe? No. Even though they are teaching, they are not able to show. That is a problem. So I'm not blaming anyone, but I have a deep grief, like the homeopathy originated in Germany, and we can't able to show one good teacher from Germany. Yeah, that's a big problem. So what happened is, from even after the Kent in America, in the United States, homeopathy is degraded. After 1927 or 1930, I think more than 40 hospitals there, right?
Yeah.
And nothing is working. In In London, there was the homeopathic hospital, London Homeopathic Hospital, and it's not working. It's not now. No homeopathy is there. It changed into London Homeopathic College and integrated medicine. No, there is no homeopathy. Everything taken up by the the modern medicine. I think only one clinic, which is it is supported by the public, because it is supported by the public. It's still working there, not funded by NHS. So what is the reason behind that? The people say that when the modern medicine arises, it's like they're not funding, they're keeping away. No, no, no. If it is needed by the people, it will arise. Because now in India, Ayush means the Ayurveda, Unani, homeopathy and all. It's a cabinet. We have a ministry for that. It's like booming up in India. We have got a lot of, in Kerala, my place, we have got a cancer institute for homeopathy. Why? Because the people needed that and the government provided that, because the government was not able to say no. It's because of the people's need. We have an infertility clinic there and you won't get an appointment for 2 years. Because last year I think more than 230 newborns from homeopathy, only with homeopathy. So the government is looking on. Okay, this is good for the people, and they are promoting.
Another topic of a lot of confusion is the miasms. Hanuman treated first mainly his materia medica pura, and then after a while he was a bit disappointed, and he developed his theory of miasms. And you have the psora, syphilis and psychosis. And now often people are speaking about new miasms. Can you explain something about your idea about this chronic diseases and this theory about miasms? Can you clarify something about it? What is your opinion?
See, after practicing for in the first previous years of practice, Hanuman stopped his practice for 12 years. 12 years. And he wrought the chronic diseases. So previously, before the chronic diseases, he was treating the patient, but the patient are coming back again, but not getting the cure. And after that, he was thinking like that, because he was like he was like thinking he's a different man. So he took 12 years from his practice and he wrought the chronic disease. So if that chronic disease is clearly perceived, psora is the main miasm. Okay, there is the mother miasm. And the psychosis and syphilis. According to Hanuman, psychosis and syphilis is like venereal miasms. Venereal, because some people who are getting syphilis and gonorrhea, after the generation to generation, the miasm is carried over. It's like that. So that is until and otherwise they are not taking any homeopathic medicine. The sequelae, that is a sequelae actually, the miasm, and is going from generation to generation. It doesn't mean that the new masters they teach like the syphilis is like the cancerous, because there is a destruction, and the psychotic is like growth and all. Okay, so Hanuman never mentioned these things. Hanuman never mentioned syphilis is cancerous. Everything is with psora. So I can see you I can show you the proof. Like I have a lot of cases of cancers which cured by sulfur, which is an antisoric, the king of the antisoric, natrum muriaticum, alumina, and all these things. According to Hanuman, these 43 or 44 medicines are the antisorics, according to Hanuman. So some others says that after that the cancers are more, and there is cancerous miasm, the carcinosin they can give, and so many miasms developed by other new teachers. But I think whatever miasm is there, the basic principles is still similia similibus curanter. Of course, you can take some sort of advice or some sort of a way, a path, aid. I think aid to find the totality. For that you can use that. Otherwise, you just follow Hahnemann.
But the idea that you have a psora, and if a psora aggravates, it goes into psychosis, and if psychosis aggravates, it goes into syphilis. That idea, which some teachers promote.
Yeah, I don't think it's big. It's because it's clearly different.
It's not
So who invented psora, psychosis, and syphilis? Who invented? Hahnemann invented. And he is not telling that psora is going to psychosis and psychosis is go. He did not tell anywhere. I'm damn sure. He did not tell that when you suppress psora, you will get psychosis. When you suppress psychosis, you will. No, I didn't see anywhere. Because according to my knowledge, I don't know. If you can refer, no issues. But according to my knowledge, I have read chronic disease several times. I didn't find somewhere that if you suppress psora, it goes to psychosis. No, it's not there. It's entirely different. So you treat like that. And why Hahnemann always says that psora is the mother miasm. And what is mother? Mother means mother is the bigger one, right? All others children. Here the teachers are trying to put like the psychosis and syphilis as the bigger ones. Psora is going down. No. Whatever it is, still I am telling, individuality is the basic. Individuality is the key of homeopathy to crack. Otherwise you will fail.
So Hahnemann developed his chronic diseases versus that he would treat just the acute symptoms or the presenting symptoms. Can you explain me a bit more? So, for example, last seminar you focused a bit on skin diseases, and you give a remedy, and then the skin disease aggravated, and you should not then think your remedy is not working. So, what is that then? That first the acute should become worse, or aggravates first?
Yeah, that's normal with the Kent's observation. You know the Kent's observation. There are 12 observations, and when in case of acutes, when you give a medicine and you get a aggravation, but he clearly says that if the aggravation is there, but the patient feels more comfortable and patient is not having so much trouble with that, that means the thing is working. The medicine is working. You don't have to change the medicine. So even the Hahnemann says that if you give a medicine and the patient is having a sort of aggravation in acute or chronic diseases, that is the vitality is working out. You know what the basic theme is like, we are stimulating the vitality, okay? And the vitality itself is clearing out all the things. That is the modus operandi of homeopathy, homeopathic medicines. That is in the aphorisms, right? So what is the modus operandi? If you give a similimum, it will stimulate the vitality. That in turn case make the whole organism into the normal. In that process, maybe there will be exteriorization of the internal maladies. That is the terminology Hahnemann used there. Exteriorization of the internal maladies in case of chronic diseases. So if you are treating asthma, or if you're treating some sort of maybe a high blood sugar or high blood pressure, you will get some sort of skin diseases, or maybe you will get some sort of pains in the joints or something like that. That means the disease is coming down. I'm telling you about the chronic diseases. It's coming down. So you don't have to touch that because the medicine is already working. But in case of acute diseases, what happens with the acute, if you are asking about the skin diseases, you should be more precise, because Hahnemann itself says that don't use antipsorics when there is an acute exacerbation. When it's sudden manifestation, don't give antipsorics, because maybe it will more aggravate the things, because this is a local thing, because it's acute. It's just aggravated. So you can think about something which is local.
What period do you think about? Because let's say a child comes and has already a whole year or 2 years.
No, that's chronic disease. That's chronic. If the child developed all the eruptions in a week, that's acute.
Okay.
The chronic means it's been treated since a long time.
Okay. So if it's of short duration, you give a non-antipsoric.
Yeah, according to Hahnemann. Yeah, according to Hahnemann. He says somewhere like, don't give antipsorics. Give non-antipsorics, and after that, if the things are clear, maybe you will get an antipsoric for that. Otherwise, the things will be. That's why the people says, the masters or maybe the experienced people says that don't give graphitis, don't give sulfur when there is a skin condition. Because that is a non-antibiotic medicine will aggravate all these things. But I believe if you have the symptom similarity, you can try that also. But only give the minimum dose. Give something dissolved and only 1 spoon.
So, and the low potency and the small dose.
Yeah, the small ones, the smaller one. Because that maybe even the patient is so sensitive, you will get aggravation. Even though you are giving an inhalation, you know the inhalation. Yeah. Even though you inhale, if the patient is sensitive, it will aggravate. Mm-hmm. That depends upon the patient. So that's what I am telling. There is no protocol because everything depends upon the patient. Everything depends upon the individuality. Because the patient is the key for homeopathy.
But, sorry that I ask again. Can you clarify this, for example, with ear infection? When should you then go for the acute remedy, and when should you not give the acute remedy and give the chronic remedy? So
yeah, if it,
with a repeated ear infection or
ear infection. That's you are telling the answer itself. Because ear infection means if it is acute CSOM, you know the CSOM. Separate, no, acute chronic acute otitis media, ASOM, acute suppurative otitis media. It's acute, so you can treat with acute. But if it is chronic, it's different because you have to give importance for the everything. You have to ask for if there is a history of any vaccines. Everything you can ask. But if it is acute, you just ask about the things happened in the recent time. Even though the vaccination, she got a vaccine, he got a vaccine, and the next day he got an infection in the ear. It's important. You have to take the rubric, ailments, vaccination after. Okay, so you will get the medicines from that. Mm-hmm. So it's there. So what I meant is normally the new generation people, homeopath says that Hahnemann invented homeopathy before 250 years, and so what we'll do for the new diseases? No, it's not like that, because the principles, it's very important. So what I have heard, I think I have read somewhere that the philosophy takes the aerial route, okay, because it has an aerial route. The philosophy exists like that. Mm-hmm. But all other things, the scientific things will come crawling like that. Mm-hmm. That's why still the homeopathic philosophy is existing. So when you treat an acute disease, you have to take the acute things. When you treat a chronic disease, you have to take the chronic. You have to go for the whole thing. When the disruption occurred, when the things derailed, derailed means he was going normal, and at some point he got a derailment. So we have to know maybe a causative factor will be there, and how the body reacted to that. That we will get by the symptoms. So that symptoms are very important. So how the body reacted to that's very important. So it's very clear why you are confused. No, there is no confusion in homeopathy. You are confused only because of the protocols, because protocol is like this. You have a written thing, and protocols, you can't fit the protocol into every individual's life, okay? Because individuality is different and protocol is different. Protocol is something you can't change because that is a protocol, right? Allopathy, in the modern medicine, they have a protocol for every disease. They will treat like that. That's why they failed in COVID. They have protocol for the viral disease, and they failed. Why? That protocol was not working because this is a new disease, and they were confused what to do. But homeopaths, they were nicely deal. My juniors, it's like they just started practicing like 3 months. They were practicing with me for 3 months. They nicely did a lot of cases of COVID during the Delta period. So only because of the principles. Mm-hmm. they are not well, they don't have an experience of 20 years or 40 years. No, nothing. They have the confidence because they are seeing the cases, and they could able to cure that with the principles of similia simplibus curanda. That's all.
Yeah, yeah. So you also mentioned that you had been working as a consultant for a institute for sexually abused women.
Assaulted, yeah.
And I think it was in Germany, in Berlin. Huh? Can you tell me something about this? Does these people need different remedies, or is this mainly psychology cases? What type of cases is that?
Yeah, the most probably the people after having all these the assaults, you mean the sexual assaults and all, most of the people, most of the women, they develop dual personality disorders like that, and they were into the verge of suicide or something like that. So my friend who was working there, I was assisting her homeopathically. So she is a psychiatrist, and she was doing the things like she will give the counseling and all. Most probably the patient will in the verge of suicide, they will call her and I'm going to die, like that. The personality disorders will be like that. The dual personality will be, sometimes they feel like they will go for a die, sometimes they feel like they want to leave and all. So this is also according to homeopathy, we have to we will get the symptoms.
You mean that they really have a split personality?
Yeah, the split personality. Yeah. But according to Hahnemann also, Hahnemann clearly perceived about how to treat the mental diseases that are the one-sided diseases. You know, the one-sided diseases. Sometimes the disease is like only one side. The symptoms we will get from the only the mental symptoms we are getting. So according to Hahnemann, when you treat that diseases, you have to give importance to the physical symptoms. Likewise, we are treating the autism. You don't take all the autism symptoms. You have to take the physical symptoms of the patient also. Yeah, we have to give more importance that, otherwise it will be the common symptom of the particular disease.
Mm-hmm. So it's not that you then prescribe more violent remedies or
no. I will give you an example, because there is a rubric in Murphy's repertory. That's the in emergency. It was there in emergency. Now I don't know. It's changed to.
It was the first edition.
Yeah, it was in the first edition. Like there is called rape victims of. Mm-hmm. Rape victims. In that, I think more than 20 medicines was there. So Calcarea carbonicum was there. I have given Calcarea carbonicum for one patient, not only because of it was like rape victims, because I got other symptoms of Calcarea carbonicum. That means this medicine is covering that particular region also. If the totality is coming inside also, you can keep that. You don't omit all the other medicine, and you have to take only the the psychic medicines. But no, it's not like that. If you read the Materia Medica of Kent, I am not telling about the Materia Medica Pura, because you will find a lot of medicines there. But if you read the Materia Medica of Kent, and if you read even the Radar keynotes, you can find the mental symptoms of all the medicines there. So we can't able to classify some medicines which are purely used for the mental diseases. I mean, for the problem, the personality disorders. If the particular medicine is covering that particular personality disorder, you can give that. So everything depends upon the totality. You don't have to make a cream like it's a cream like some medicines are for the this thing, the personality disorders, some for the mental diseases. No, it's not like that. But you can find, so see for stramonium, you can find the fear of violence and violence also, because the stramonium patient is violent sometimes and they have fear of violence also. So every medicine has got a particular level. So if a patient is having other symptoms of belladonna or hyoscyamus or others, how could you able to give the stramonium to that patient? No. If the totality is with belladonna, you can give that. If the totality is with stramonium, you can give that. You can't avoid that's why Hahnemann said that you have to be free from prejudice. This free from prejudice is not only applicable during case taking. It is applicable during the whole process. The whole process means the case taking, the remedy selection, the differentiation. So when you take some medicines into the instance for the particular case, itself is a prejudice. How could you take some medicines and you just differentiate that medicine? That is not good. Because you might you might miss many important points of the other medicines, and you won't get the cure also.
So it's not that the mental symptoms are hierarchically most important, and you do not pay much attention to
Yes,
others.
mental symptoms are important, but in a mental disease, what is the problem? If that is one-sided diseases,
Okay, so in a mental disease, that is normal for the disease.
Yeah.
And is not characteristic anymore.
yes.
Okay.
So that's why Hahnemann pointed out, you don't take the more mental symptoms. So a depression patient, how is a depression patient normally? He will be depressed. So don't go for that. You give importance for the physical symptoms. And the mental symptoms, which is peculiar and which is different from that particular mental disease, you can take that. If in an autistic child, you are not supposed to take the echolalia
Yeah, and a hand
and all
flapping
these things.
and
That's a normal
toes
thing.
roping,
Yeah. 95%, no, 96% of children,
Autism, yeah.
autism people will
Who have hand flapping, walking the toes,
that is not a peculiarity.
and not talking. Okay,
And the eye contact, no.
that is then normal.
Yeah, that is applicable for all mental diseases.
Yeah.
So you have to give importance for the peculiar. If there is any peculiar from the normal, what is to be shown in a normal disease, for that you have to read, you have to know what is the normal disease.
Yeah.
The medical knowledge, you must have the medical knowledge.
So let's stay for autism. For autism, you say, let me check all other 100 to 1,000 autism cases.
Yeah.
And the symptoms they mostly have in common,
Yeah.
you ignore.
Yeah. Because individuality is important.
Okay.
Individuality important. In autism cases, you can go for the history of mother during the pregnancy.
Yeah.
Because that's very important, because what she had,
Yeah.
that is very important. So that's different with different cases, because
But it's difficult for the beginner because those symptoms are very impressive, like a child running around in circles, doing all
Yeah,
like that.
yeah.
This is the thing which are most impressive, but actually they are the least important.
that's why Hahnemann, that's why I am telling always go for the basics, because Hahnemann itself, he said that individuality is important. So what is individuality? Individuality means a particular disease, how the patient reacts different from others. That's individuality. So if you get 10 cases of fever, 10 cases of fever, and the 10 cases the patient is different. So you have to give different medicines. If the modern medicine, what they give is paracetamol. You know the paracetamol. So for them there is a protocol. If the patient is coming with fever, you give some antipyretic along with antibiotics. I don't know what is the reason why they are giving. Maybe the secondary infection they are telling. But in homeopathy there is no protocol. In homeopathy the only thing is individuality. So how a patient reacts, the particular stimuli. If you got drenched in rain and you are okay, I'm getting fever, I'm having pain all over the body, I am restless, I just wanted to go like this, and the resting aggravation, this is Rhus tox. But the same time I drenched in rain, I can't able to move, I want to take rest. If I started moving, I will get more problem. I have thirst, I have dryness in throat. It's bryonia. So it's different. The people are, the vitality is acting differently. So you have to find different medicine for all the people. That is why homeopathy stands on. Otherwise, everybody we will get. If people get, somebody is drenched in rain, you will give Rhus tox to every patient. No, Rhus tox will not act in every patient. The simillimum would be there, but it's different with the genus epidemicus and all. It's a different it's a different. So a lot of people are having the same symptom. We will take the main symptom. That's why the arsenic amalgam came. during the COVID period. In India, we found that arsenic amalgam was working. That's a different vein. We will just leave that.
Yeah, yeah. So I understood from you that this coming seminar you will go a bit more into advanced case analysis, more explaining more strategies to get a balanced repertorization.
Yeah.
That you and that you will use focus some more on pathologies, which here in Western countries homeopaths will get.
Yeah.
Because you are more or less a first liner and you get everything, but in Europe, unfortunately, a lot of severe pathology cases we do not get because they go immediately to the hospital. And you will focus a bit more on the patients you have treated from Western countries.
Yeah.
Okay.
Yeah. It's like see. What I can do is I'm doing from fever, from skin diseases to cancers in my place. Everything is come to me. Yeah? So I am doing that like a daily basis, 50 to 60 patients. So I am not aware that what you people want. Like it's not a tailor-made thing. So if somebody asks me to do, I just wanted to know this. So I can show that because I have a lot of cases. I have recorded a lot of cases. So if you ask me, I want to see what happens with this case. So we can show that, no issues. And if the European cases, because I have groups in Spain and Greece and Germany like that. So what happens there is we are doing some workshops, like normally the doctors will come with the patients because if they are not getting the results, they will come with the patients, and I'm dealing that patient. We will take the case taking, and after that we will discuss about what to take and what rubric to take and how the medicine we have to arrive, and we will give that medicine, and after 3 or 4 months the patient is coming back to us in the next workshop, and we can find that the patient is cured or patient is getting the symptoms are getting lowered. So I can show that cases also, because that's with the European people. But I don't say that European peoples are not having the bigger diseases.
Yeah.
We hear also the first I heard that the main cause of death is cancer in Netherlands.
Cancer is still the first. First
and if a patient comes to you, if you are in Europe, and a patient comes to you having cancer and he's not having any other options, what will you do?
Yeah.
You have to treat that. You can't say that no, I can't treat you. No, you have to treat that. For that also I am trying to give the knowledge, because it's not like complicated thing. The problem is like we thought that this is complicated. No, it's not complicated. Because of the principles, you are complicated in your minds. Because of the protocols, you are complicated in your minds. Only thing is similus curanda and the totality. Yeah. Maybe I have said more than 100 times during this period, because that is very important. Back to the basics. Yeah. Whatever things you are learning in your life, without the basics you can't able to go up. Yeah. So do the basics. That's the only thing you can achieve. You can achieve anything in homeopathy, or you can cure the patient. Do the basics. When you are away from the basics, you will destroy. That is very clearly seen in the Western world, because whenever they started to derailed, or whenever they started to go away from the normal homeopathic principles and behind all the protocols and all things, it started degraded. Yeah. It is clear. It's clear. I'm not telling bogus or a hawks. Not. Yeah, it's clear. In homeopathy, when you check the what we say statistics of homeopathy, how homeopathy decreased. It's decreasing in Europe. Yeah. What is the reason? You just think about that. What is the reason? You have a lot of doctors, new doctors interested. They are coming, but they are not having confidence. They are failing. Only because of the reason that they are not in the right path. Mm-hmm. If they were on the right path, homeopathy would not be degraded here.
Mm-hmm. So thank you, Dr. Veneeth, and I'm looking forward on to your next seminar in the Netherlands.
Yeah.
And I enjoyed very much, and I learned a lot of your workshop here in France. So thank you very much, and you have to travel again in March.
Yeah.
So I hope to see you then.
Yeah.
Me and my co-organizer Janneke, we're looking forward, and we thank you for the opportunity.
Thank you, Rene. We will do that. Yeah, thanks.